To adult mental health in the time of COVID. This is an evening discussion of about 1 hour sponsored by the Brookline Department of Public Health. And it's looking at two main questions. How has the pandemic affected the mental health of adults in the US? And what does this look like in Brookline? Also, how are adult mental health needs being addressed in Brookline? And what are some concrete resources for mental health care? I'm Carrie Goldberg. I'm a journalist, a longtime journalist, longtime Brookline resident, and I'll be the moderator this evening. We have three very distinguished panelists, all local, all experts in mental health. And to start us off, I'd like to hand the floor to Dr. Swanee Jett, who's the Director of Health and Human Services for the town of Brookline. Dr. Jett.
Good evening, everyone. So this has been a long anticipated and awaited conversation that we need to have about mental health. And so I urge all the residents and citizens of Brookline to please, tune in. We have a wonderful panel for guests, and they're going to begin to really dissect some of the things that's going on in Brookline and what you can do. And I also want to congratulate and thank all the panelists and thank the town of Brookline for the support. And thank you, Carrie, for hosting this.
Sure, my pleasure. So just a couple of minutes of housekeeping. Each of our panelists is going to talk for about 10 minutes. If you have any specific questions that arise in your mind, something that you don't understand or that isn't clear as they speak, you can put a question into the Q&A at the bottom of your screen, and I'll try to keep an eye on those and ask the panelists when they're done. After each of the panelists has presented, we'll then have time for general audience questions, which you can also put into the Q&A. And if you have any personal questions, like if you need help for somebody or for yourself, at the end of the session, there will be a feedback form, and you'll be able to put your specific questions or requests into that form. So that's the run of show. I want to just also begin with just a couple of words about the national picture. So the Kaiser Family Foundation does a survey particularly on reported symptoms of anxiety and depression. And normally the results are pretty steady. It's about 1 in 10 people report symptoms of anxiety and depression. Through the pandemic year, it has pretty steadily been 4 in 10 adults report symptoms of anxiety and depression. And that's not even counting all the other stuff, like the huge numbers of people who are having problems with sleeping and eating, and particularly with substance use. So the general picture is that we have this dramatic and understandable and unsurprising overall worsening of mental health nationally. And we also have to figure that that comes on top of what was already a mental health system that tends to be straining at the seams, especially with problems in terms of access. So that even states with lots of resources like Massachusetts, and even communities with lots of resources like Brookline, I am always grateful to live here, but we've had no immunity to this sort of perfect storm of mental health issues. And that's what we're here to talk about tonight, and then about what can be done. So I'd like to hand off the floor to our first panelist. Jason Kaufman, PhD, LMFT, is a couples and family therapist at the Brookline Center for Community Mental Health. And he manages there the in-home therapy team. He was formerly John L. Loeb Associate Professor of the Social Sciences at Harvard, where he taught politics, popular culture, and public health. Jason, please take it away.
Thanks so much, Carrie. Thank you, Dr. Jett and Lynn Karsten, for organizing this, and thank you everyone for turning up for such an important discussion. There's a lot to say, so I'm going to dive right in. An important caveat: I'm not an epidemiologist. I have not looked at any town-wide data. I'm speaking as a mental health provider in the town and as a Brookline resident. With that said, it doesn't take professional experience to know how grave the impact of COVID has been on the mental health of adults in our community. You've experienced it yourself, I would guess, in one way or another. We can look at this as essentially two populations. On the one hand, people who faced mental health challenges before COVID seem to find them get significantly worse. Hopefully, in many of those cases, that people in that population were already receiving services and were able to convert over to telehealth. We've had a lot of success converting to telehealth. Unfortunately, there's another population of people who may not have been experiencing mental health problems before COVID, or were and were not getting services for them. And what it looks like is that there's sort of an iceberg phenomena here, where we're seeing above the waterline people who we know are struggling and seeking services, but we don't yet know the magnitude of folks that are suffering and not receiving services. So if there's a basic bottom line message here, it's that in terms of the medical aspects of the pandemic, we are perhaps at the beginning of the end. But in terms of the mental health impact, we're really, if we're lucky, we're at the end of the beginning. And keep in mind too that mental health care tends to be time consuming and intensive. So we've got a long road ahead, even once we're able to get back to some of the vestiges of life. I will say one important exception to the population of people who were already suffering mental health is people with severe social anxiety. What we've seen is that population in some ways has been relieved of the thing that makes them anxious, which is going out and about in public. And there's a reasonable question what life will be like for those folks once we're returning to face-to-face life, and how we're going to reintegrate, particularly young adults who have been very happy not to go to school, and maybe people in the general population who have been happier in virtual space, and we'll need to want to find ways to reintegrate them. So it's helpful, I think, to think about a few different vectors of influence so that we can better understand how COVID has impacted us and what the lessons learned might be. At the most general level, we have all experienced a traumatic event, not unlike a natural disaster or the Boston Marathon bombing, which many of us lived through, but worse, in the sense that all of us were in danger. It was not a short-term event, and we didn't even know how long the impact would last. So in a sense, we've all suffered a sort of complex trauma from this earth-shattering event that ruptured our basic understanding of reality, our expectations of what do you do in the morning, how do you get your basic needs met, how does the world work. Sociologists have long known that when that kind of the norms of basic social life collapse, people suffer mentally. Emile Durkheim, the sociologist, first studied this when he was studying the causes of suicide, and he named this phenomenon anomie. So it's not surprising that there's been normlessness in other areas of life, in our political sphere, homicide rates, that in a sense, when all bets are off, people start inventing new rules for themselves, and we're facing a crisis of norms and uncertainty about how we will reestablish that in our lives. At another level, this has been a crisis of sociability. And again, there are variable impacts. For many of us, we were living with family or friends before COVID, and suddenly we were really living with family or friends, right? Being on lockdown with the people that you love the most can be really difficult. And we've learned a lot of lessons there. You know, for one, we need a lot of variability and novelty in our social context. Being with the same 5 people, person to person, gets very difficult. We've also seen a crisis in caregiving, that it's incredibly difficult and stressful to be taking care of one another 24/7 without any relief, without any other resources. I want to highlight, it's not a new phenomenon, but COVID has certainly shed a bright shining light on gender inequality in terms of caregiving in American households, that as it so happens, most of the burden of homeschooling and taking care of dependent adults has fallen to women, not surprisingly, and that this has created an unbelievable amount of stress for women and working women in particular. I don't want to miss the other side of the equation, which is people who were living alone prior to COVID, either by choice or necessity. And that was a very different but equally challenging kettle of fish. Spending a year with very limited face-to-face contact with other people can also have devastating impacts on one's mental health. One thing I think that we can learn from this is, as lucky as we are to have virtual technologies to allow us to connect outside of the face-to-face realm, it's really not enough for our basic human need for contact. We experience warmth and empathy and attachment when we are in person with people, and that is missing in our virtual worlds. The other thing I've seen firsthand is how unequal access to virtual technologies are. So there are families that don't have reliable Wi-Fi or don't have enough devices for the members of the family. There are also seniors and people with intellectual and emotional disabilities that makes technologies like Zoom very hard to access. And in some cases, we've had to treat folks with the telephone because we couldn't do telehealth, and there was a difference. So if telehealth is not quite as good as face-to-face, telephone is not quite as good as that. So COVID hit us hard in our social lives, and we are profoundly social creatures, and denied ordinary opportunities to socialize, we all suffer. There's a third dimension here, I think, which relates more closely to anxiety, and that is living in fear. Living in fear of death or long-term illness if one is exposed to COVID. Many of us lived in fear of losing our jobs or losing our homes. And it's clear from before COVID and during COVID that in itself has a major impact on folks' mental health. And it goes without saying also that those risks, the fear of death, the fear of economic decline, is unevenly distributed across our population. And one thing we've seen here in Brookline, as well as everywhere else, is that we are disproportionately reliant for essential services on the lowest paid people in the highest risk categories. So, COVID has really shined a bright light on the structural inequality in our society and how interdependent we truly are. So what do we do? What are the lessons? I think most basically, we have learned a profound lesson in the vulnerabilities of our society in terms of inequality, racism, sexism, ageism, ableism. We are all party to a system that unfairly distributes risks and rewards of our society, and we've all seen the vulnerability of that. A colleague made a very telling statement. He said, if he was talking to me as a white male, if I were to take the experience I had of basic fear of my well-being and my life, a person of color experiences that many times that level of fear every day of their life. So I think we've all had a chance to valuable lesson in empathy and to understand what the vulnerabilities are in our community. A second challenge is going to be to reestablish a balance between virtual lives, or virtual spaces, and social spaces. I think we face a genuine challenge in sort of turning back the clock, so to speak. It's as if we jumped a decade in internet years because of our need for it during COVID. And it's clear that we need more balance in our lives, and how we get there, I think, is going to be a challenge for our entire community, our school system, etc. And lastly, and this is, I'll segue to my colleague, Rachel Hennessy-Kroll. Clearly, we need vastly more mental health services, more affordable mental health services, but we also need better outreach and access, because there are clearly many, many people who are in need of help and not currently accessing it. Thanks a lot.
Great. Thank you, Jason. We will transition to Rachel, but first, just for anyone who came in late, if you have any specific questions about what's not clear to you, that's something that a speaker says, you can put the question into the the Q&A at the bottom of your screen, and I'll try to keep an eye on those. And if there's any question that needs to be asked immediately, I'll pass it along. Otherwise, we're going to hear from each of our three panelists, and then I'll ask a couple of questions, and then we'll go to audience questions. And if you have any sort of personal or more specific questions, you'll be able to ask them in a feedback form at the end. So let's move on to Rachel Hennessy Crowell. She's MSW, MBA, LICSW. She's the manager of school-based services and adolescent child groups program at the Brookline Center. And in this role, Rachel carries an individual and group caseload. She's a clinical supervisor. She conducts program management, and she's a consultant and collaborator with the public schools of Brookline and provides direct oversight of the BRIGHT program, which is wonderful, at Brookline High School. And prior to joining the, oops, sorry, that was Jason's timer. And prior to joining the center, well, anyway, that's what she does. Rachel, please go ahead.
Sure, no problem. I am just, hello, everybody. I'm glad to be here, and thank you, Carrie. I'm just going to take a moment to share my screen. All right. Maybe someone, this is working, right?
Looks good so far.
Thank
Yep.
you.
Mhm.
So thank you, Jason, for such a thorough sort of summary of the ways this pandemic and health crisis have amplified and created new challenges for our mental health system and for all of us living through it. I'm going to be speaking more specifically about resources and referrals, what is available out there, how might folks access that, and then what can we do sort of for ourselves beyond those formalized accessible services. So speaking first specifically about the services available at the Brookline Center for Community Mental Health, we have, as listed here, individual therapy, family therapy, parent coaching or guidance, and group therapy. For group therapy, we have both like a model of interpersonal process groups, so sort of spaces for a long-term commitment and to learn through relationship to other people about kind of oneself and how we function in relationships, as well as time-limited groups on focused topics like dialectical behavior therapy, parenting, things like that. So in terms of access, like this, I included here our direct phone line for our intake team. Every single person who calls is going to hear sort of the worst case timeline for waiting. And the reason for that is the folks, we want to prepare people for that and be upfront about the possibility. And every week, decisions are made about assignments based on insurance, schedule, and the urgency of what's going on with an individual, a family, or their constellation. So it is always worth an inquiry, getting on a list, no matter how long you think it might be, and being really clear about what is going on for you or your loved one. And similarly, like I would really invite folks to consider non-traditional behavioral health interventions. So things beyond like, I want an individual therapist for me long-term. Short-term therapy, time-limited therapy is a great option for a lot of folks to reduce distress in a significant way and accomplish goals in a short-term manner. Similarly, groups are a wonderful way that like programmatically we can increase access. The more people we are able to serve in groups, the more then we can use our individual services for folks whose needs cannot be met otherwise. Excuse me. All right. Whoops. Okay. And then speaking specifically to the community programs, so other things beyond the traditional mental health support that are offered, and I should say very clearly that so many of these services are possible only in partnership with the Department of Mental Health or other programs in Brookline Foundation, all of those. So the Safety Net Financial Program, that's for emergency sort of one-time things. everything from like air conditioners to mattresses to rent assistance, that type of support. The Care Connections Case Management is our newest program. This is a time-limited case management service that is meant to join a family and any existing sort of team members they have, whether that's mental health providers, school staff, that type of thing, and to accomplish some short-term goals. So helping folks do a benefits inventory, perhaps reevaluate their health insurance so that they can get better access to other available services or other types of things like that. And then in addition to that, we have the Homelessness and Homelessness Prevention Emergency Services Grants. We have a transitional housing program. And then we have a team that does consultation and service coordination for Brookline Housing Authority residents. So anyone in there being able to get light touch case management through those folks. And that's the best number to reach the members of the community team. And that is the best email for folks who prefer that. So then thinking beyond the center, because of course there is a rich and important world of mental health support beyond the Brookline Center. And for folks with some private insurance, it is a great idea to explore all your options at the same time. So places like Psychology Today are a great place to search for clinicians in private practice. The Meeting Point is an excellent source for folks with intersectional identities, either identifying as gender fluid, or perhaps you identify as a person of color, or have a different ability, that type of thing. Specific resources are out there and have only become more further developed, I think, through the climate of this past year for folks of color seeking to work with a clinician of color specifically. And I'll say, the fact that groups everywhere have pretty much transitioned to telehealth, since many of us, our buildings were not meant to have 12 folks in a room sitting 6 feet apart. We don't have that kind of space, and I imagine many other organizations have those same challenges. But what that means for members of the community seeking support in that way is your options have grown exponentially. So being able to access a group that's operated out of California, that type of thing. And then for anyone who's had a specialized experience, I mentioned META, that's for folks with looking for an eating disorder specialty, or BARC, Boston Area Rape Crisis Center. These types of organizations are very well poised to make specific recommendations and sort of endorse clinicians who are proficient in those specific areas of need. And then what can you do sort of for yourself in addition, or while you're waiting, or for those you love? Really focusing on meditation and mindfulness. There are so many wonderful apps out there that are available across platforms. These are just some of them. I really recommend that folks try more than one. Find the one that speaks to you. Do you like someone to guide you through a visualization, or do you want someone to just cue you on breathing? Do you prefer sort of a yoga nidra breathing, something like that, or do you want someone to walk you through a reflection on your day? There are so many free options out there, and these are just some of them, but noting some specifics that are designed in particular for folks who identify as Black. And then here we are. When I shared these ideas with a colleague, she said to me, like, social media for self-care? I usually try and get off social media for self-care. And I think what I would say here, and what I mean with these, social media provides opportunities to connect with people who've had a shared experience as you, and there can be many ways that listening to someone else's story can be really affirming and connecting. Of course, there are ways that these types of platforms can also, leading to sort of a mindless scroll, and then suddenly you're up 2 hours later than you meant to go to sleep. So recommending really, when we go on to social media or YouTube, is to really set an intention. Like, what are you hoping to get out of it? And then once you accomplish that, get off. And then, of course, connecting in real life, outside, getting back to nature, noticing the way The buds are still going to come, even though we're all barely emerging from our pandemic cocoons. Can be really validating and provide space to just be with one another in real life, as Jason said. And just particularly highlighting on here the million podcasts and sort of sleep stories, these resources that folks have created and that are available for free to facilitate some of the aspects of mental health that we have seen arise, and difficulty sleeping in particular. Sleep stories are specifically designed to facilitate ease of sleep. Okay, and so that is what I have to share here.
Great, thank you, Rachel. I have one quick follow-up from an audience member who asks,
Sure.
do you find that Brookline residents would not want to participate in group therapy in Brookline because they might not want to run into neighbors and friends in the group? And do people who live outside Brookline use the center?
Yes, that's a great question. And the answer to everything is yes, the center is open to folks who do not live in Brookline. And groups in particular have long been, the membership has long spanned beyond Brookline. And we recruit well from across our child, adolescent, as well as our adult groups programs. And the way we sort of handle that, of course, protecting folks' confidentiality. We can't like sit with a potential group member and say, and let them know the membership and just kind of check. So what we do instead is we ask that potential member, are there any names of folks that you would feel totally uncomfortable in a group space with? And then we sort of have a way of saying, you know, this group's composition is not a good fit.
Got it. Great, thank you. Okay, moving on again, just one more reminder for people who came in late, you can put, if you have a specific question, something you don't understand that a panelist says, you can ask it immediately in the Q&A, and we will now hear from one more speaker, then I'll ask a few questions, and then it will be open for audience questions, which you can also put into the Q&A. And if you have a personal or a specific question, there will be a feedback form at the end where you can ask for something that's more maybe personally related or a need for a referral or anything like that. So, so moving on, next, at third and last of our speakers is John Cohen. He's an addiction therapist for individuals and families with a private practice in Concord. And he's also the co-host, along with Brookline resident Abby Dean, of the Right Mind Media podcast on WUMB, a radio show covering addiction, recovery, and mental health issues. Don't miss it. John.
Thank you, Carrie. Thanks for having me here, guys. And Jason and Rachel, that was really actually helpful to contextualize these things for me. I'm going to share my screen as well and get you can all be treated to each shot for a moment while I get up and running here. So, you know, when we see a rise in these mental health problems that Jason spoke about and Rachel addressed, you know, we often see a rise in substance use issues and incidents of substance use disorder. And, you know, this is a once in many generations situation, so there's nothing really to compare it to. But it makes sense that given that the main drivers of addiction, along with biological and environmental factors, are co-occurring mental health issues like anxiety and depression and trauma, that you know, that's given a big bump to substance use disorders. And let's face it, if there was ever a perfect storm for anxiety and depression and trauma, this pandemic is it. So in my own practice, you know, I see adolescents and I see adults and I work with families. And before the pandemic, there was, you know, a good mix of everybody. I would often see a lot of adolescents and young adults with cannabis use disorders who are experiencing trouble with cannabis use and other substances as well. Alcohol often went along with that. Since last March, I've seen kind of an explosion of everything from 20 somethings to boomers and everyone in between present with a lot of alcohol use issues. And it's important to think of substance use problems on a spectrum where somebody may just be experiencing an increase in their drinking that wasn't there before the pandemic, and it's not gotten to the point where they're full-blown alcohol use disorder or dependency. It may just be causing little problems in the family. And then on the other side of that, we have, the severe alcohol use disorder. I've also seen people struggling with misusing prescription medications like Adderall and other stimulants, as well as benzodiazepine-based anti-anxiety medications and opioid pain medications as well. So a big jump in alcohol use problems among my clients. And then nationally, on the scale of, nationally, we've seen incidence. There's a recent study, incidence of alcohol dependency has risen 300% in the last year, since 2019, and severe alcohol dependency 400%. Those are things that we've never seen a jump like that in any situation. Alcoholic liver disease is up 30%. There's a higher incidence of alcohol use disorder and alcohol related problems among women, because like Jason mentioned, it breaks down with gender, with a disproportionate amount of stressors again being placed in the lap of women, and watching out for family, and all the stresses that we can talk about. The opioid related ER visits are up 29% nationally, and overdose deaths, mainly opioids, are up 3%. That's after we were seeing a little bit of a leveling off. The numbers aren't in nationally. That's the 3% is Massachusetts. Nationally, the number is higher, especially significantly in other states. So why is this happening? I mean, the obvious things that Jason spoke about and Rachel addressed. Social isolation. If I am a person with, kind of a predisposition towards a substance use disorder, that social isolation, while like Jason mentioned, it might be a boon to some folks with social anxiety, it's really difficult if I am in recovery, let's say from substance use disorder, and I'm used to going to self-help meetings and things like that. We saw a lot of relapses. We've seen a lot of relapses during the pandemic. Financial and job insecurity is, a great stressor for a lot of people. And all these things can be thought of as just increasing the mental health issues that bring people to misuse substances. Family stressors, less access to services. I saw everybody shaking their head when we were talking about getting folks in for help. And there is, many of my colleagues are not accepting clients at this time. It's difficult to access. There's the technological issues that remain as a barrier for folks. In the substance use treatment field, many services are being, once people get into treatment, are being held virtually, and some places like residential treatment centers are accepting folks, and they have kind of a safety protocol they go through before folks are in the general population. So that's opening up a little, but from last March to midsummer, places, rehabs, and traditional intensive outpatient programs were all virtual, and that presents, again, kind of a little bit of a burden for folks with substance use disorders trying to get well and to get help. And then, of course, the social and political unrest of the last year has, I don't think there's a client that hasn't mentioned to me just how stressful that is. So, we're dealing with a full plate right now, all of us. So a lot of people always want to know, a friend has a problem. I think my friend has a problem, or maybe I have a problem. And how do I know if somebody is experiencing difficulty with it? And on this list that you can see here, we have the criteria we use in the field that tells us that if somebody's experiencing a substance use disorder, but it's not nuanced. And it's, you know, if you or your loved one answer yes to one or more of these, there may be a substance use problem, you know, present. What I like to go for is just a simple question. I think it kind of cuts to the chase. Is, are alcohol and other drugs having a noticeable negative impact on your life, right? So that doesn't mean we have to jump into detox that day or anything like that. What it means is it's time for me to seek help. And so what should I do? This is where a lot of people have difficulty because there's so much information out there. Again, substance use problems are on a spectrum. So it's not appropriate for somebody who's smoking more cannabis than they normally would and maybe having depressive symptoms from that to go necessarily into residential treatment. First thing I want to mention is that if you or your loved one experience withdrawal symptoms when you stop using whatever substances you are using, you might need a medical detox program. All bets are off in that case. So this, you know, these things I mentioned here are kind of, you know, the precursors to going into treatment if that's the appropriate level of care. First thing, get assessed by an appropriate professional, and that could be someone like me, some of the mental health folks that you can access in your community in Brookline. If you are experiencing mental health problems, often for a lot of folks, the first medical contact is your primary care physician, or if you already have a mental health clinician, please bring it up with them and discuss it with them and discuss kind of appropriate next steps with them. Some of your other choices are, you know, working with an addictions counselor on behavioral change and mindfulness, attending self-help groups. I can't say enough for the power and the efficacy of self-help groups like AA and Smart Recovery and Recovery Dharma and Refuge Recovery and Narcotics Anonymous and Marijuana Anonymous. They're really wonderful, especially during the time of COVID. Everybody's virtual. You can attend meetings in California or I had a friend who attended a meeting in Brussels the other day who speaks French, and he was telling me about it. And you can also find intensive outpatient programs that meet virtually, and that's a nice middle level of care if you're experiencing some problems. And then to kind of echo what Rachel was saying, you know, I think a great place to start, if it's not a major issue that you're experiencing, is practicing self-care. There's no downside to meditation. There's no downside to mindful attention to mood, and there's no, you know, the best treatments we have for depression and anxiety are mindfulness practice and exercise. And that's easy for me to say because I'm not experiencing depressive symptoms. But look into that stuff. There's a lot of wonderful stuff online. You know, teens can access, Rachel mentioned YouTube, and they can access that stuff. So there's a bunch of stuff out there. And how can I help? If I see a loved one with, you know, a problem, reach out if you think someone, you know, someone who has a problem. Talk to the family members, talk to the friends, ask healthcare professionals questions. You know, silence is complicit behavior, right? I'm basically I'm underwriting your behavior if I'm not addressing it. And then be supportive and non-judgmental if a loved one has a problem. You know, this is, stigma kills. Substance use disorders are medical conditions. They're not a moral failing, and there's no, you know, guilt and shame keep a lot of people from accessing help. These resources are going to be part of I think, an email that's sent out to every attendee. I can't say enough about the Mass Substance Use Helpline. It is a wonderful first place of contact to receive treatment, to find out who takes your insurance and match you up with a treater and the appropriate level of care for your insurance, including Mass Health. Treatment Atlas is a wonderful new service that helps kind of cut out the middleman in assessing the appropriate level of care. So confidentially, and it's very, there's a lot of integrity in Shatterproof's websites and their goals. So that's really helpful, and it helps folks like me kind of get out of that busy work of getting folks assessed. Self-help groups I already mentioned. And then for families and loved ones, there's a wonderful resource called Allies in Recovery. It's based here in Massachusetts, and it's free right now for everybody. But they give counseling, they give group support for families, and they give also educational tools on how to best support yourself and your loved one while they're seeking recovery. So thank you.
Thank you, Don. I have a quick follow-up from audience member. How do you recommend people cut back on their drinking if it's just creeped up over the pandemic?
Oh, that's a great question. And there's some really specific ways that you can do that. One is to become mindful and keep a drink diary of your drinking, and become mindful and set small achievable goals. If it's crept up and maybe you're drinking 30% more or something like that, there's even apps that you can kind of access that you can keep a drink diary and then look at it and say, okay, I want to cut back down to X amount. A lot of things we do like that are just habit. So, habits can change, but a lot of times we're not paying attention, and we do it out of habit rather than out of need. And so it's the same way if you're you're paying attention to it, and it becomes, you can also pay mindful attention and enjoy. If you're not a problem drinker, you can enjoy the drink a little more, and if you are experiencing problems, you can kind of cut back.
There's an interesting parallel to when you're trying to lose weight, and just keeping a food diary will focus your attention and make you realize how much you're eating. Great. So thank you to all three of you. I have just a couple of questions, but I most want to get to audience questions. And actually, I'm going to jump right to one of them because I was thinking about this as you were speaking, John. An audience member asks, can you speak to issues you've seen regarding the use of cannabis and marijuana? And I was thinking it was such an interesting convergence of the pandemic happened right as cannabis stores were opening in Brookline. It came at the same time. What are you seeing? What effect, positive or negative or in any direction, are you seeing?
That's a great question too. I don't have anything against cannabis use or anything like that, but some people experience difficulties with it. And so I've had clients who don't have a problem with it tell me that it's actually helping them sleep, or it's one way, before at nighttime where they're, taking a hit or something like that, and they're experiencing some freedom. On the other side of that, there's people whose cannabis use has increased during the pandemic, and they are experiencing the typical things of cannabis misuse. If you have a predisposition towards depression, cannabis can increase depressive symptoms. It can help people get more stuck than they already are. It can also cause problems relationally with people. But really, I think for us, recreational cannabis use, and it must be weird hearing a substance use person say that, is something that I think it's on the harm scale, it's fairly low if it's used wisely. The problem is, again, that there's some people who don't use it wisely, or they have co-occurring mental health issues in which case it can really cause problems.
Okay. Another great question from the audience. This is probably, actually, this is the biggest one in my mind, which is that we have a mental health system that doesn't, it seems to me, doesn't have enough capacity. It doesn't have enough access, particularly when you factor in insurance and all the difficulties with finding care providers who will take the insurance that you have. And what we've seen is that over the last year, teletherapy has just exploded. And is it in fact changing the paradigm of mental health care to the point that it can make a difference in the mismatch between the supply and the need? Or I should just read you the audience member's question is, do you think teletherapy sessions will continue after it is safe to meet in person again? Rachel, do you want to start with that one?
Sure. I think absolutely, and probably most likely in a blended manner for many folks. There'll be folks who need in-person all the time, as there have been throughout the pandemic. And then there'll be folks who prefer teletherapy all the time. Just speaking to our specific examples here, if I'm seeking substance use support, I might now be able to work with someone like John, even though he's in Concord. And in a typical day, in my typical schedule, I wouldn't have time to drive out there where it's lovely to be, and then get back to my life here and my responsibilities. So for a lot of folks, for parents, for kids with busy schedules, for young adults, being able to pop into their car and have therapy on their lunch break is increasing access and maintaining sort of a lot of flexibility and more consistency in care.
Jason or John, do you want to add anything?
I agree entirely with Rachel. Telehealth does a lot in terms of accessibility. It doesn't really address the supply and demand problem completely, in that the basic model is that you sit with a person for the better part of an hour on a regular basis, and there are not a lot of efficiencies to be found there. So it is easier, we're finding, for our clients to get to us. There's less missed appointments, but we still need vast numbers of more therapists to be providing services in any modality.
Right. Although there was a question that came in a little earlier. I'm sorry, I'm late getting to it. An audience member says, I'd like to hear more details about the apps that you could recommend. And I would just add, to what extent do you think apps can take the place of a therapist, if at all?
I mean, that's a great question and probably a really individualized answer. I think there are incredible opportunities for self-care. The ones I listed and showed were really focused on mindfulness and meditation, but things like being able to express art on your phone or monitor, maybe keeping a drinking diary, as John suggested, the basic healthcare apps, as well as sort of like the low tech things, like setting a reminder every hour to get up and move, even though you work in this chair and you sleep in that bed and they're right next to each other. Those kind of ways that we might impact our habits through those types of reminders. Yeah.
The way I look at it is that there's been a great awakening in terms of the need for mental health services, and now we're in a period of great ferment and experimentation. And I think the market will tell what modalities, what apps are useful for people and what aren't. But clearly, the one size fits all, you sit on a couch for 50 minutes is not what everyone needs. So the fact that there are all these new flavors of getting mental health treatment, I think, can only be good.
Yeah, it's an interesting period. We're getting loads of questions from the audience. Thank you, guys. Keep them coming. Can you please say a bit more about Allies for Families? Who runs the programs and are they groups? Rachel, I think that's for you.
I'm sorry,
Yeah,
Allies for Families?
Allies for, or what was the name of
that
the,
was
or
that
John,
might be John.
you? Yeah.
Yeah, Allies in Recovery.
Uh-huh.
There's a whole big bunch of services. I think the groups are moderated by a professional, But and these aren't the only groups available for families, by the way. There's a lot of other wonderful organizations that I can also send out as support, like Al-Anon and Nar-Anon and things like that. But Allies has different types of groups, but they also have educational materials. There used to be a paywall where you paid for these this educational stuff. It's based on something called CRAFT, which is a kind of communication evidence-based way of working with somebody who is resistant to change, and it's very helpful. And this is family support. That's about all I can say about it.
Okay. And we'll be sending out information about it in the follow-up email that goes out to, we'll be sending out all the resources that were mentioned tonight, I understand. Okay, next question. This is a burning one. How do you help people with social anxiety who are having a really hard time adjusting and reintegrating to in-person life? Anybody? Rachel.
I can take a shot, sure.
And Jason, maybe? Yeah.
I mean, I think a gradual approach, and I would feel really curious about the nature of that social anxiety, if that's amplified by concerns about safety related to transitioning to in-person life, or the nature of that. We see this, we are certainly seeing this a lot with kids and adolescents who've been in remote school and are now transitioning back. So a lot of parents needing to support their children around this type of thing. Starting with the easy stuff, like the walk in the park near other humans, and perhaps a little bit closer, and then perhaps hanging out with folks that are familiar, and then sort of gradually increasing it from there. Knowing it's going to be an adjustment, knowing it's going to be hard, planning on how you might cope, and how you know when you're pushing too far. Like kind of the stretch, not snap thing.
Jason, do you want to add something?
I think Rachel hit the nail on the head. The only other thing I would add is helping people assess the assumptions they're making about the danger they fear, and check those assumptions and test them so that they know that it's not safe. But yeah, a gradual exposure approach, and not pushing too hard, particularly if it's your child.
It sounds like it, I mean, the problem may be more social anxiety as opposed to fear of COVID, right? It's having to go back into being with people in person again.
I've seen both varieties. I have worked with people for whom their fear of COVID seemed disproportionate to their actual risk, and they were not only refusing to go outside, but not letting their family members, and it did become a larger issue. So that's its own sort of phobia.
On anxiety, yeah. Okay, another question. Have any of your clients reported new and inexplicable sleep patterns? For example, waking up at 3 or 4 a.m. for the day, regardless of attempts to change it? And have you seen people struggling with disordered eating more than usual as well? That's
I have definitely seen all of the above. Sleep difficulties can be a leading indicator of mental health problems, and we've seen a lot of people struggling to get to sleep, to go to sleep at the right time, to stay asleep. I think it's just a larger symptom of all the ways in which people are struggling. And similarly for eating, people who struggle with eating too much have had extra problems with that, and people who struggle with restricted eating have also struggled. I think in any way in which your life was difficult in the mental health realm, it potentially got a lot harder because of all the stress and disruption in our lives.
Next question. What can I do to help a teenager in my life whose parents don't support her getting a therapist?
Yeah. So this is a really tough one, because I can hear in that question that this person cares a lot about this adolescent, and sounds like they think they might have a need for a therapist, or perhaps they want a therapist. What I don't know is what it means that they don't support her, whether that's generally or whether they're specifically against a therapist. Unfortunately for minors, their custodial adults do need to consent to therapy of all kinds. So in the absence of that, folks are really left with stuff that is accessible, and that includes leaning on perhaps their team at their school, whether that's guidance or other, a trusted teacher, something like that. Also emergency hotlines like the Samaritans or other accessible resources. If it's a matter of like, how do they amplify their need or communicate their need to their parents, I think encouraging them and collaborating with them about that, and perhaps in consultation with their team at their school or something like that.
Got it. Jason, can you say more about reestablishing a balance between virtual space and real space?
And try. I think virtual spaces were designed to be convenient and cheap and accessible, and they've been incredibly helpful in getting us through a time when we can't meet face to face. And my concern is that people have become overly reliant on them. I'll add, many virtual spaces are custom designed to keep a person active and busy on them as much as possible. So to give but one example, many young adults have found video games to be a way to relieve stress and boredom in some positive ways, but those games are designed so that they're very hard to turn off. And like anything else that's hard to put down, there's a real risk, I think, that people don't get away from their screens and go outside, engage in real life. And I think what we've learned in the last year is that there's a real cost to that in terms of both individual well-being and the health of our community.
So we just have a few minutes left. Audience members, if you have any remaining questions, now is the time to shoot them up. Here's one. Do you think teletherapy will encourage practices to hire more therapists, regardless of their location, to increase supply in cities which will have greater demand due to population density?
Yes. both because
what? Go ahead.
it's just that there are ways that seems possible and necessary, even if we don't assume that the person hired in a place far from where they live is going to work fully remotely. So perhaps you commute in 2 days a week, and therefore you're willing to work somewhere a little bit further from your home. And certainly at the center, I think we imagine maximizing our utilization of our physical space by doing hybrid time in the long term.
John, do you see that helping in the substance use field?
I do, because what happened just naturally, at the beginning of the pandemic was we had a whole large amount of folks with medically assisted treatment that all of a sudden had a lot of difficulty accessing those medications. And they're, initiating, let's say, buprenorphine treatment, which is, Suboxone and things like that. There was a significant amount of hoops to jump through. And now that's been streamlined, and the government kind of helped with making that happen, helped with access to getting things rolling quicker. So I think that's here to stay. I also think the folks that I work with, the cohort that I work with, are specifically driven to not be in a room with someone if they can avoid it early on. Or it's easier for them in a lot of ways. And so it has streamlined that. There are places where it's difficult too. I think I can probably speak for my colleagues here in saying that there was an adjustment and a bit of a learning curve for doing virtual work with folks. And you're not in the room, you don't have those cues, those physical cues, and a lot of the things that we rely on, in our work. So, and on the other side of that, people receiving services had to do that. But I'm getting calls from folks saying, you know, it's fine if you're not going back. You know, I live in Western Mass. Can I, you know, can I do this? So, you know, it's a brave new world for us.
Yeah, it really is different. Well, we need to wrap up. I want to thank all three of our panelists so much for coming, sharing your wisdom and your expertise. We will be sending out a follow-up for everyone registered, and it will include a summary of this meeting and all of the resources that people mentioned, links to lots of helpful resources, and also a very short feedback form, which we would really appreciate your participation in if you possibly could. I really want to thank the Planning Committee, Mary Minot, Abby Dean, June Harris, and Karen Campbell, and the Brookline Substance Abuse Prevention Program staff at BHS, Darlene Johnson and Lynn Karsten from the Health Department. And thank you for coming. Actually, if we have just a couple more minutes, I want to apologize to our panelists. I didn't warn you that I was going to do this, but when I was doing a lot of pandemic reporting early on for WBUR, I established a habit or a pattern of always trying to end on a positive note, because there was so much bad news and it was so scary that I just felt like there had to be a silver lining here and there. And so I'd like to ask each of you, just as we go out, to name something positive that you see coming out of this for your field and for the public. So who wants to? Yes.
I thought about this a lot, and I just couldn't fit it into my 10 minutes. I think, you know, the town of Brookline in some ways has truly risen to the challenge of COVID. There's been incredible creativity and generosity and warmth in finding innovative ways to get meals to homebound seniors, to provide social opportunities to teens. Everywhere you look, people are being generous and considerate. And I think the basic fact that town government has stood up, that the lights turn on, that essential services have been existing, that we can get groceries. Like, there is a lot to be thankful for, that we could go through an ordeal like this and still be standing as a community.
Standing. Yeah, John.
Well, besides those, you know, kind of the streamlining of access to treatment, which I think is hugely important. I also, you know, personally, I'm so impressed by the resilience of human beings. I mean, it's just so powerful to see how people get through this, and folks at every end of the spectrum of need and things like that. It's been a really mind-altering experience for me in the way I approach working with folks. So that's been the big kind of aha moment.
Cool. Rachel.
I think the conversation we were getting to towards the end about telehealth and the opportunities for increased access, the opportunities to collaborate more, for all of us to live a blended sort of live-work life, is really exciting and demands more and more creativity. So I'm really looking forward to seeing how the field evolves in those areas.
Great. Thank you. And we had one last question come in. Can you share apps for art and art therapy? And this question will be answered in the follow-up resources that will be sent out. There was also another request for just apps, like what are the good apps? And so we'll make sure that that goes out in the follow-up messages that everybody gets. So again, thank you all for coming tonight. I'm Carrie Goldberg. Thank you to all the people who put this together. Hang in there, guys. Can see the end in sight. Thank you. Take care. Bye.